Believe me, if there are advancements in cancer research, it's happening at the James Graham Brown Cancer Center. Another reason to be very proud of this city. With me now is Dr. Anthony Dragun, and Dr. Dragun is a radiation oncologist. Dr. Dragun, welcome back to the show.
Good to be here.
Okay, I've already heard, because you apparently spent some time in the green room with Dr. Samuel, that you have a really cool toy. We're going to talk about the CyberKnife. I think there's a lot of questions about this because this is cutting-edge technology, so to speak. I know it's not brand new to someone like you, but to folks like myself, it is brand new. So this will help you explain this, right?
Sure. Well, you know, we're on today to talk to people about Brain Tumor Awareness Month, which is May, and the CyberKnife is a big component of treating tumors of the brain and the spine that previously may have been untreatable. And so it is a toy, for lack of a better term, that we have available to us in town. It's a piece of technology that is the only one of its kind in the region, and we're happy to offer it to patients of the Kentuckiana region.
So when you talk about brain tumor awareness, I have a few questions for you. One would be, are brain tumors genetic? Is this something that you can inherit? What would be the warning signs, that kind of thing? Because when I hear brain tumor, of course, that's an alarm. Thanks to the folks at James Graham Brown Cancer Center, don't get me wrong, there are very positive advancements, but I'm going, how would someone know? I mean, this isn't something that's like going to show up in your blood test, right?
No, it's not. Unfortunately, there's no real early detection method or screening for brain tumors. The majority of brain tumors are actually cancers that have originated somewhere else. So someone has a lung cancer that's spread to the brain, or a breast cancer that's spread to the brain, and that may be their first diagnosis of cancer, may be at that stage, or it may be somewhere along the diagnosis of their cancer. But there are 180,000 new cases of brain tumors in the United States every year.
Wow.
And it's a mixture of those cancers that have come from somewhere else, benign brain tumors, and then brain tumors that originate in the brain. In terms of how they're diagnosed, it's usually someone coming in with stroke-like symptoms or a seizure. So they feel weakness, they feel numbness or tingling on one side of their body or the other, or they may even have an episode where they pass out, or they may have headaches and double vision, those types of things. And then they're brought into the hospital, tests are done, and MRIs and scans and things like that, and we are where we are, and then we have to treat it.
Now, are brain tumors genetic? Are they something that run in families or no?
Not typically. There are some genetic, very, very rare genetic disorders that put people at a higher risk for some brain tumors, but typically they have other diseases as well that are associated with that. Things like neurofibromatosis, where they have other medical problems as well that enables them to be screened earlier for brain tumors.
Okay, now, this is the fun stuff. Let's talk. I love talking about new technology, and as I said, this may be old technology to you. CyberKnife, how long has it been around, and exactly what are the benefits of using a CyberKnife on a patient?
Well, the original prototypes were developed about 10 years ago now, but the technology, just like everything, just like with our cell phones, with television technology, computer technology, everything has gotten better exponentially since that time. So what this machine essentially does is it's a robot, it's a robotic arm that is originally similar to the kind of robots that work on an automobile assembly line. And on the end of it, this piece right here is a miniaturized linear accelerator that produces cancer-killing radiation. And so just like those robots on an assembly line, this can move in almost any degree of freedom and motion to get almost any angle to treat tumors that are in various locations in the body that were previously unreachable, and do it in a completely non-invasive fashion.
So non-invasive, I would guess more focused?
Totally customized. Actually, this machine has in it an iris that's inside this area at the tip that actually opens and closes in a customized fashion to treat not only the angle, but the actual individual shape of the tumor. And so you can treat a cancer that may be right up against the spinal cord, and if that cancer is either removed surgically or if it's treated with traditional radiation, there could be a high risk of damaging the spinal cord, but you can treat it completely safely with this, with sub-millimeter accuracy.
All right, Dr. Dragun, you ready to field a call?
Sure.
Let's do it. Vicki is with us. Vicki, welcome to the show. Good afternoon.
Good afternoon.
You have a question for Dr. Dragun?
Yes, I don't have a tumor, but about 5 years ago I was diagnosed with a cyst on my pineal gland, I believe it's called.
Sure.
And they told me there was pretty much nothing they could do about it other than just keep an eye on it.
Right.
Is there anything I need to do?
Well, this is an interesting question because what she's talking about is a very rare condition that may represent a benign disease, a disease that close observation with multiple images taken over a period of time to make sure that this isn't changing or causing her any problems may be appropriate. But the thing that I would emphasize to patients like this is never take the answer that there's nothing they can do about it on its face. We have a multidisciplinary brain tumor team at the Brown Cancer Center, and it's where radiologists, neurosurgeons, neurologists, oncologists, and radiation oncologists sit down together and review the case that's presented before us, and everybody has an idea and comes to a consensus about the plan. And so it's not just one doctor that's driving the care of the patient, it's a team approach. And with complicated cases like that, that has to be discussed in a multidisciplinary fashion.
I love that. To me, that makes such common sense.
Yep.
In that, 2 heads are always better than one,
Right.
and 6, of course, is better than one.
Right.
And you may have, and with all due respect to your physician, he may think, okay, this is all I can do. But when you got 6 or 7, they may be familiar with a type of technology,
Sure.
or a study that has been done that could benefit the patient.
Medicine is moving so incredibly fast, and not only technology, but the evidence surrounding what to do in different cases, that it really does take a team of subspecialists to come up with the best available treatments at any given time for any type of disease, especially cancer.
Doctor, you did a great job of articulating exactly what the CyberKnife does. We talked about the importance of a CyberKnife or how it can benefit someone who has a brain tumor. What other types of cancer can the CyberKnife help with?
Or So there are lots of different cancers, both inside the central nervous system in the brain, the spine, but also within the lung, or the liver, the abdomen, and the special challenges with those is that they move with lung tumors, especially as a patient breathes and their chest goes up and down, the tumor moves as well. This machine actually moves in real time with the patient's breathing motion to track the tumor in real time so that you know that the beam of radiation is treating just that cancer and not destroying any normal lung tissue unnecessarily.
I want to get from your perspective. For me, there is a real sense of pride with the James Graham Brown Cancer Center. For instance, I had a couple in that we entertained for Derby Week, and they mentioned that their mother came into town. And I was thinking, well, perhaps they wanted to see one of the tourist attractions or whatever. They said, unfortunately, she had cancer, but they were real happy with the results that you were able to achieve there. For you as a physician, as a radiation oncologist, is there a pride factor with working at a place like the Brown Cancer Center?
Well, absolutely. I mean, I think that it's really the crown jewel of cancer care in this region, and I'm honored to be associated with it. From my perspective, it enables us to develop new technology, but also to be a center of excellence that's a place for the entire community to go to. If you are the kind of person that goes on the internet and researches all of your medical care, you're going to find that the experts in the region are there. If you're the kind of person who doesn't have anywhere to go and you don't know where to start, you can come in the door without an idea where to start and start with us. So it's a great place to be.
All righty, there's the information up on the screen. Dr. Dragun, thank you very much. We'll be right back. Thank you for joining us on Wave 3 Listens.
Lots of people, just like you, are getting results with a doctor-prescribed HCG diet.
I felt like there were certain things people my size couldn't do. I found myself making excuses and turning things down. When I heard about the Body Shapes Medical HCG diet, it didn't take me long to connect to it. I feel like I've taken control of my life. I don't feel like I'm too fat to do the things I want to do now. Body Shapes Medical helped me reach my goals and get the life I wanted.
We have yet another Mother's Day gift for you. This book, The Susie Homemaker Chronicles, is all about parenting. So it's a perfect gift for Mother's Day. Great light reading, very, very funny, but very informative as well. If you'd like to win the book, be caller number 3 now, 888-800-9283. I'd like to thank the good folks from Body Allure for joining us, and of course, Dr. Dragun, thank you very much for coming aboard.
Thank you. Always a pleasure.
Always my pleasure. We love the James Graham Brown Cancer Center. And we'll see you tomorrow. Thank you for joining us on Wave 3 Listens.